Okay, so this is an introduction to Synapse to get you going and introducing you to the many aspects that Synapse has. The first thing that you should know about Synapse is that there are many different ways to get to the same place, to get to your images or to your patient. Um, Whether you choose to go through all studies, all patients, or go through the different specific site folders. It'll all basically get you to the same place, but hopefully this will show you some of the most efficient ways to get to your images. Um, the Probably the quickest way to see your images is to go to the patient specifically and going to all patients. That brings us to our second point of that there the only number that you should use in Synapse besides the accession number is the Sharp healthcare number. The medical record number is not recognized in Synapse. So, for example, I'll pull up a test patient with their Sharp healthcare number, and we'll show that it'll bring up their exam. So, uh, putting in their specific patient ID or Sharp healthcare number brings up the patient, only this patient, because only one Sharp healthcare number exists for each patient throughout the entire Sharp system. And then if you double click on the patient, it'll bring up a list. This test only has one test exam, but it would have multiple exams for this one patient, and you could search by a session number and narrow your search even further, or click on the procedure and or date and narrow your search by that. And finally, the last basic thing you should know is that the modality work list is fed by Synapse. So if the exam is scheduled through Cerner and for some reason there's a block and Synapse doesn't receive it, your modality work list will not populate with that exam.